In this video, I'm going to be talking about vascular laser treatments. Firstly, I'd like to describe what a vascular problem is. Vascular problems can occur in many different forms. Usually we treat those on the head and neck. A common example would be broken capillaries on the cheeks or around the nose. And these are really superficial blood vessels which are visible to the naked eye. Often the underlying cause of these blood vessels is a condition called rosacea, or it can simply be due to chronic sun exposure. Another vascular concern that we commonly see is poikiloderma, which is a red-brown discoloration on the side of the neck. Again, this is most commonly caused by sun damage. Other vascular problems that we commonly treat here are port wine stains, which are red-coloured birthmarks, usually occurring on the face, and these are also treated with vascular lasers. With modern lasers, we're able to treat a lot of these vascular problems quite effectively and safely. We often use lasers such as the Gemini Laser, which are attracted to vascular structures in the skin and not attracted to normal skin structures. So we're able to specifically target vascular problems in the skin. For example, a little blood vessel running across the cheek, we can actually target that without affecting the normal skin or causing any problems with the normal skin. These vascular lasers work by emitting a very specific wavelength of light that is highly attracted to blood, but minimally attracted to other structures in the skin. So we're able to pick up specifically certain vascular problems in the skin and leave the normal skin alone. The laser will essentially heat the blood vessel, shut it down, and you can see this immediately during the procedure, and the normal skin surrounding that will be left unaffected. When you come in for your first consultation, your doctor will take a history from you and ask you questions surrounding the concern that you have. These may relate to your past medical history or medications that you might be on, as these might be the underlying cause of your particular vascular problem. It's also important to make an assessment of your skincare regime. So please bring in your skincare regime, or at least write it down so we can actually help assess if these products are making your skin condition better or worse. Your doctor will need to examine your skin quite carefully, and if you're wearing makeup, we'll need to remove this makeup for you and have a look at the skin, usually under some magnification, to see what sort of concerns there might be there. Once a proper diagnosis has been made, we can then determine whether you'll be suitable for treatment or not. There are some conditions which cause redness of the face that are not necessarily related to underlying vascularity. For example, keratosis pilaris rubra is a skin condition which is not readily treated with vascular lasers. However, conditions like broken blood vessels, redness of the neck due to poikiloderma, and other vascular conditions are readily treated with vascular lasers. Although the thought of being treated with a laser can sound a bit scary, vascular laser treatment is actually a very controlled and relatively comfortable treatment which produces excellent results. The first step of the procedure may involve, but not necessarily involve, the application of numbing cream. It really depends on the patient's preference as well as the severity of the problem we're treating. The numbing cream helps to numb any sensation that you might feel from the laser. Laser treatment feels like a bit of a hot and prickly sensation on the skin. It might be like when you're cooking and you might get a bit of oil dart onto your skin. It might have that similar sort of sensation. The laser is fired over the areas of concern, and the operator usually has magnification on, as well as protective eye goggles, and they're able to see the effect of the laser on the skin in real time as they're doing it. Other than numbing cream, we have a lot of techniques to help reduce any discomfort, and one of the main techniques is skin cooling. So either the tip of the laser handpiece will be chilled, or you may have a hose that you hold to blow cold air over the treatment area. Now, cooling the area has a lot of benefits other than reduction of any discomfort. It also helps to protect the epidermis, or the top layer of skin, while the laser penetrates through that and hits the target just under the skin. So you're protecting the normal skin at the same time. In regards to the treatment itself, there are a couple of ways to address the particular concern. If there are just a few little broken capillaries, it's possible to use a very small laser beam and just trace over these capillaries, like connecting the dots really. This has virtually no downtime and has very little discomfort associated with it. For more widespread vascular problems such as widespread redness of the cheeks, either due to broken capillaries or due to, say, a birthmark, often it's necessary to use a slightly larger laser beam and stamp over the area in a systematic pattern. Now this does hurt a little bit more and can cause more downtime and swelling after the procedure. After the procedure, what you may expect is a degree of warmth in the face, and we help to combat this with some either ice towels or a cooling device or some cold air blown over the face. And usually after a few minutes this subsides. There may be a mild sunburn-like appearance which persists for 24 hours or longer. Swelling is quite a common side effect that occurs after the procedure and something that we expect, the degree of which can vary from just minimal swelling or no swelling to a large amount of swelling for more aggressive treatments. In the case of a very aggressive treatment, you may find that swelling occurs at the point where your eyes become swollen over and you look a bit bee-stung. And the best way to treat this is by sleeping at a 45-degree angle or in a more of an upright angle. Often this takes about 4 days to subside. Also, there's a degree of redness after procedure, and this will depend on the severity of the procedure as well. For smaller procedures, the redness may only last a couple of hours, and for larger ones, you may have a couple of days of redness. Occasionally, if you are prone to sunspots or freckles, these may become slightly darker for up to a week after procedure and sometimes may come off. If you experience any blistering or scabbing of the skin, please give us a call to see whether it's normal or not in your situation. If you experience any pain or discomfort after the procedure, please contact us, as this is not a normal side effect. In regards to the number of treatments we perform for each condition, this will vary and will depend on the person and their circumstances. For broken capillaries, often 2 or 3 treatments are required to get an even result. The capillaries around the nose can often be very stubborn or problematic and may require multiple treatments. At times, they do not disappear after multiple treatments, and this may be due to an underlying problem, say hay fever, where you're blowing your nose a lot, or whether there's some underlying blood vessel which is causing these capillaries around the nose. Generally, we require treatment intervals to be around 1 month apart, but no shorter. Some vascular conditions, such as port wine stains, may require up to 20 treatments, and even after that time may not fully resolve. Complications can occur with vascular laser treatments, although with proper patient selection and also settings of the laser, these are rare. I'll briefly go through these complications with you now, and these are not intended to alarm you, but just to inform you of the possibilities before you decide whether you undertake the procedure or not. One of the unusual complications that occurs is infection of the skin after treatment. This can be due to a reactivation of herpes simplex virus, cold sores, say around the mouth or in the other areas of the face. If you have a history of cold sores or herpes simplex, please inform your doctor, and often we are able to prescribe prophylactic medication to help prevent these outbreaks. Skin reactions can also occur after the procedure. These may occur more commonly in people with very sensitive skin and may appear to be like a rash or sort of breakout after the procedure. Darkening of the skin is a complication that can occur after vascular laser treatment. It usually occurs in those with olive or darker skins, or those people who have active tans. So if you do have an active tan, it may be worthwhile delaying treatment until such a time where your skin is lost its tan. Darkening the skin post-laser treatment is a problem that is readily treated with lightening serums and usually goes after some months. Lightening the skin after laser treatment is a rarer complication and usually indicates some sort of scarring. To put things in perspective, scarring is an extremely rare complication and something we don't generally see here. So after your laser treatment, it's important that you look after your skin properly to get the best results and to minimize complications. Usually we'll ask you to put some sort of cream on the face, whether it be some bepanthen cream, which is simply nappy rash cream, or some sort of enriched moisturizer. It's important to stay out of the sun and wear sunscreen on a daily basis. Vascular lasers are highly effective and can significantly reduce any redness or vascular problem of the face and neck.